Our patients are happy with the treatment, as it improves their quality of life. Hi everyone, I'm Roberta de Filippis. I'm an obstetrician and physiotherapist, and I specialize in pelvic floor rehabilitation. I work mainly with the pelvic floor, especially since I became a mother 20 months ago. I've been using the EVA device for about 1 year, as I wanted to offer my patients the most comprehensive treatment possible. My patients were happy when we introduced this new technology to complement the treatment they were already undergoing. Vulvovaginal atrophy is still a little unknown pathology. In spite of the fact that about 50% of women in menopause show its symptoms. Burning, dryness, and painful intercourse. It's a disease of the cells and it's degenerative, which means it tends to worsen. For this reason, an early diagnosis is fundamental to reduce the symptoms as soon as possible and to restore the proper lubrication of tissues. The greater oxygenation obtained also affects blood circulation. There is a greater supply of blood in the cells. When the device was introduced in our practice, it was a real breakthrough. Because radiofrequency acts not only on the superficial parts of the epidermis, but reaches in much greater depth. Vaginal laxity is a condition that can affect women of all ages. Surprisingly to many, it can even affect very young women, as it can be a postpartum pathology. This may be due to the weight of the pregnant uterus on the pelvic floor throughout the pregnancy, as well as to the pushes during labor and natural childbirth. The presence of vaginal laxity can in turn cause the prolapse of pelvic organs, that is the bladder, uterus, and rectum. And sometimes more than one of these organs may suffer prolapse at the same time. Thanks to the introduction of EVA into my practice, I've been able to treat this pathology in full. The first improvements in terms of comfort appear after the first sessions, and our patients are obviously happy to see the benefits of the treatment so soon. Stress urinary incontinence is a very common pathology in women. Also in this case, it affects women of all ages. Not only women in menopause, but also younger ones. It is commonly thought that a small leakage of urine when coughing or sneezing is normal. This is absolutely not true. Even if it only occurs once a month, that is a signal the muscles in the area may have lost their tone. An early diagnosis and thus early treatment leads to a quicker, more successful solution of the problem. Thanks to radiofrequency, I can provide a comprehensive treatment. Because in addition to physiotherapy, which acts on the weakened muscles, I can also work on the deeper component, ligaments and fascia between the layers of pelvic floor muscles, and thus obtain lasting results. Stress urinary incontinence affects men and women alike. With the new tip flat, I've observed a major improvement during the session, thanks to its flatter, much less invasive electrode. It can be used in both severe vulvovaginal atrophy, because it's much less painful to the patient, and in all cases of chronic pelvic pain, where the area is extremely sensitive. It can also be used in other proctological conditions, such as rectal prolapse, because the flat electrodes make inserting the tip much less painful for the patient. As for the new tip used for vulval injuries, I obtained good results in treating patients who had had scars or episiotomies postpartum, including painful ones and including a few years from childbirth. It also produces a much more effective action in lesser-known pathologies like vulvar lichen, Soon after the first sessions, patients usually give me a very positive feedback. They often had to undergo heavy pharmacological therapies with major consequences in terms of comfort. Thanks to our treatment, it was possible to stop treatment with corticosteroids. A treatment combining radiofrequency with electroporation or UPR enables medical professionals to tailor a treatment on each patient's specific needs. For example, if I need to hydrate tissues in addition to conductive gel, I will use a hydrating substance. While if I need to reduce inflammation, I will add a product that acts on the inflamed tissue. I've been using 4+ in my practice for about 6 months. I decided to introduce this technology because the patients are more willing to start physiotherapy. The treatment itself does not last more than 20-25 minutes. It produces no scars, it doesn't require rest time afterwards, which means it can be done even during lunch break, for example. Most importantly, results appear very soon. Quality of life improves, which means the patients are more than happy to undergo this treatment.